But one of the things you said is that in this model, you're going to need people that have been successfully healed, in a sense, gotten themselves and reversed disease. Does this model then can it be at all applied to conventional medicine whose level of success isn't reversing disease, it's managing it in symptom resolution and kind of, Band-Aids?
Yeah, it's a great question. Right. So I think coming into this world naively at the beginning, I was like, well, if I could just show the doctors that this is possible, surely they'll just do it. And that's not the case, right? There's a lot of friction in that transformation. They don't believe it. There's not enough data. If it was real, they would have heard about it. This isn't science. This smells like something that I've heard to be told to be wary of, all of that. So, and then also like the purpose of my book was to try and like make it as easy as possible to make that shift. But there's still a lot of friction in there of adopting these groups. And that's why, up and before the pandemic, group medicine is amazing. Like, why hasn't it been adopted everywhere? Why hasn't it grown? Why hasn't it scaled? Why isn't it the standard of care? It's new and it's different and it takes a bit of time and there's all this friction in delivery. So in the model that we've created now, what we have is that we deliver these groups as a service to existing healthcare infrastructure. And so what that means is the doctors don't have to learn anything new. The patients, the payers that pay for conventional medicine, i.e. Medicare, Medicaid, commercial insurance, pay the bill, right? So there's nothing new has to happen. The doctors, they have providers, they have insurance contracts, they have patients, and we partner with them to deliver these lifestyle medicine groups as a service. Now, we've positioned it hopefully in such a way that it is the least offensive to your average doctor, right? So, most doctors, when you speak to them, would agree that patients should do more healthy behaviors. And I've told them a million times, and why won't they do it, right? So let's just start with that. They may not understand systems biology. They may not understand supplements. They may not understand esoteric lab testing, there's all things that they don't understand or they can't get on board with. But what can they get on board with? And what we found is that, doing lifestyle medicine, especially if you could do it in a sort of a profitable way, right? And an organized way and a way that extends their care team and allows them to make more money. And, sort of, if you can really think about positioning it in a way that reduces all the friction points, you can get some traction. So that's kind of what we're focused on now we've created a sort of a delivery system for virtual lifestyle medicine groups. We sold it initially to clinics that took insurance, but had some sort of interest in functional, integrative and lifestyle medicine. But now we're starting to sell like hospitals and health systems and bigger entities. And the whole point is like, let's not have a plan where the hardest things to do are necessary to do in order for it to work. Let's try and do it the easiest things to do. And that's just iterating, learning, throughout this time and just trying to ride the wave as opposed to, fight the ocean.